right. Hi, my name is Janet Gonzalez, and I'm going to be doing my full assessment on my patient today, Miss Avila. So we're going to be starting just taking a look at my patient, the general appearance of my patient, and making sure that she is healthy and well, she's not ill, doesn't show any sign of distress or depression. So I'm going to go ahead and say that my patient is happy and well, and she's in happy spirits today. So next we're going to do the hair, nails, and skin portion of the assessment. So the first thing I'm going to do is kind of just inspect my patient. I'm looking for any lesions, abnormal moles, any growths on her skin, anything out of the ordinary. So as I look at my patient, I can see that she is pretty clear throughout, so nothing to be concerned about. Next, I'm going to take a look at my patient's, palpate for the temperature and the texture of my patient. So she should be, I'm going to use the back of my hand, and she should be warm throughout, which would suggest good cardiac output. If the environment she's in is cold, her extremities could be a little bit cold, but in her case, she is warm throughout everywhere. Perfect. And as I did that, her texture to me seemed soft, it seemed firm and even, so all within normal range. Next, I'm gonna check her hair distribution. I'm gonna look at her hair on her head first and note that it is straight, dark, shiny, healthy looking. There's no patchy baldness, so everything is within normal limits. We can look at her eyebrows and her eyelashes as well and note that it is even again. We can also look at her arms, her legs. It's easier in guys obviously because they have more hair, but she does have a thin layer of hair on her arms as well. Next, I'm going to do the nail bed. So what I'm looking for here is any ridging or clubbing, which I don't see any at all. She does have flat nail beds, which is normal and means that she measures about 160 degrees. Clubbing could be abnormalities like cystic fibrosis, for example. All right, perfect. Next, we're going to do the cardiac aspect of the physical, so if you want to lay down for me. So the first thing I'm going to do is I'm going to kind of just inspect my patient. So I'm going to inspect her precordium, her anterior chest, and make sure that there aren't any lifts, heaves, or thrills. I'm also going to be seeing, sometimes you can see the apical impulse as well. So I don't see anything out of the ordinary. So next I'm going to palpate. So I'm going to palpate for any lifts, heaves, or thrills, again, just around the cardiac area. And I'll work my way around the sternal border as well as the base. So you're going to feel my hand on you, Miss Avila. Okay, and I did not feel any abnormalities. So next I'm going to listen to my patient. So what I'm listening for are rate, rhythm, and S1 and S2. So the quality of all of them. So we're going to be listening to the mitral, the aortic, pulmonic, Erb's point, tricuspid, and then the mitral areas. So we'll go ahead and do that now. You're going to feel my stethoscope on you, okay? Perfect. So I didn't hear any abnormalities. My patient is, her rate and rhythm is normal. Her rate is between 50 and 90 beats per minute, which is within normal limits. And her rhythm, I'm going to go ahead and say my patient is in sinus arrhythmias and she is normal. S1 and S2 were not diminished and not attenuated. So that concludes the cardiac part of my assessment. So next we're going to move over to the respiratory. So I'll go ahead and have you sit up, and if you can kind of just face this way, and I'll need your back exposed towards me. All right. So first I'm going to inspect my patient. So I'm inspecting for for the rate, depth, ease, configuration. So I'm making sure that everything is symmetric. Her spinous process is symmetric. When she's breathing, she's not in any kind of distress and seems to be bilaterally even on both sides. So the next thing I'm going to do is I'm going to palpate my patient. So what I'm palpating for are any masses around her lung fields. So I'll go ahead and do that now. You're going to feel my hand on you. Perfect, so I didn't feel any masses, which means she's within normal limits. So next I'm going to do the symmetry. I'm going to check for symmetry, make sure that my patient breathes in and out symmetrically on both sides. So the way you do that is you place your hands on your patient's back and pinch a little bit of the skin, and I want you to take a deep breath in and out. Perfect, and my hands did go back and forth evenly, suggesting that she is breathing even on both sides and symmetric. So next I am going to do the tactile fremitus. I'm going to check for tactile fremitus, which is the vibrations. So I'm going to palpate in a couple different areas and around her lung bases, and just make sure that I hear her say 99, and I feel the vibrations basically on my hand. So I'll have you say 99 every time you feel my hand.
99, 99, 99, 99, 99, 99.
Perfect, which I did hear, or I did feel the vibrations throughout the whole thing. So next I'm going to percuss, which means she is within normal limits. If I wasn't to be able to feel vibrations, it could suggest fluid in the lungs. I will percuss. I should be hearing dullness over the scapulas, over the shoulder area, and then resonance over the rest of her lung fields. So you're going to feel my fingers. Perfect, and that's exactly what I heard. I heard the resonance over the lung fields and the dullness over her scapula areas. So next I am going to auscultate. So I'm going to auscultate just listening for breath sounds. I shouldn't hear any friction rubs. I should hear no wheezing, crackles, so I should hear clear lung sounds. So we'll see. I'll check on the posterior and anterior side. So go ahead and take deep breaths as soon as you feel my stethoscope. I'll do 2 on the front, if you can just take a deep breath in. Perfect, so I heard no abnormal sounds, everything is within normal limits, clear lung sounds all throughout. So next I'm going to listen for the egophony, which is basically a test to check for abnormalities. So what I'm going to have my patient say is an extended E sound. I should be listening to E when I auscultate her. If I hear ah, then that means that there's an irregularity. It could mean fluid or consolidation. So if you don't mind just saying E every time you feel this stethoscope on you.
E, 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 E.
Perfect, so I did hear her say E and there's no ah sounds. So next we're gonna do the bronchophony. So basically I'm gonna have her say 99, and I shouldn't be able to hear her say 99 exactly, like very clear, but it will be muffled and soft. So, and if I were to hear her say clearly, then that means abnormalities again. So if you don't mind saying 99, Miss Avila.
Or like 99?
Mm-hmm.
99, 99, 99, 99, 99.
Perfect. So everything is within normal limits, and now I'm going to check for the whispered pectoraliquy, which is her whispering 99. Perfect, and I should be barely hearing anything at all, if anything at all, which is what I did. I shouldn't be clearly hearing her whisper. So next I'm going to do the vascular part of my assessment. So if you can just go ahead and lie flat again, Miss Avila. Yep, how we were before. Perfect, thank you. Alright, so the first thing I'm going to do is I'm just going to be inspecting her pulses. So I'm just kind of looking out for any bulging, any abnormalities. You can look at her carotid and jugular veins, make sure that they're symmetric on both sides as well as all of her pulses. But you can see like a light tapping in some patients, which is normal, that's fine. So next I'm gonna palpate. So I'm gonna palpate her carotid first, and then I'll work my way down with the pulses. So you're gonna feel my hand on you. And I feel it there. Okay, so then we'll work our way through, and I will do the brachial pulses. And you want to make sure they're symmetric. Okay, and I'll do the popliteals, which is behind the knee. These are difficult sometimes, but I do feel them. Okay, and then we'll do the posterior tibial and the dorsalis pedis. Okay, so all of her pulses are symmetric bilaterally, suggesting good cardiac output and even pulses everywhere within her body. So next, the last thing I'm gonna do is the abdomen and flank area. So what I'm gonna do first is I'm going to inspect. I'm just taking a look and making sure that there aren't any pulsations, any scars, and that the contour of my patient is flat, which is good. And the skin color is the same as the rest of the body. So next I'm going to auscultate. I'm going to auscultate for bell sounds in all 4 quadrants. So you're going to feel my stethoscope again. Perfect. And then I'm going to auscultate her liver and spleen, make sure there are no friction rubs. Okay, and her aorta and renal arteries with the bell side, make sure there are no breweries. Okay, so next I am going to percuss. So I'm going to percuss her abdomen and make sure that I'm hearing tympany over, or I'm feeling tympany over the stomach and intestine area, and then I'm going to hear dullness over her organs. So I'm going to go ahead and place my hand on you. Which is exactly what I heard. Okay, so next I am going to percuss the liver border. So I'll work my way up from lower to upper, basically until I hear dullness. Okay, and it should measure about 6 to 12 centimeters, the liver, which is within normal limits. I'm going to percuss over her liver, spleen. Okay, perfect. So next I'm going to palpate. I'm going to palpate lightly first. So I'm going to use one hand. You're going to feel my hand again. I'm palpating for any masses. Any discomfort anywhere? Okay, and I'll do a little deeper palpation. Any discomfort? No. I will palpate for the liver border, which should be non-tender, firm, and smooth. So if you can take a deep breath in and out. Any pain? No. And again, the spleen I'm checking here. Deep breath in, no. Any pain? No. Okay, now I'm going to check the kidneys. I'm going to palpate the kidneys. So I'm going to check on when she exhales. So deep breath in and out. Okay, and one more time. And out. Okay, perfect. So kidneys you don't want to feel, which is good. I didn't really feel them. If you do feel them, they're a little bit abnormally enlarged, so it's good that we don't feel. Next, if you can just sit up for me with your back again towards this way, and we'll check the costovertebral angle. There we go. So this is checking for any abnormalities in the kidneys. So let me know if you feel any pain or tenderness. You're going to feel my hand. Any pain? No. No? Okay, and this concludes my assessment. Thank you for watching.